Please welcome Roman Maron, German Cancer Research Center, Heidelberg. Expanding the toolbox for skin cancer screenings via artificial intelligence.
Hello, so our group works on improving the diagnosis of skin cancer, and that's what I'll be talking about today. So skin cancer is a very serious disease, and it's difficult to diagnose, extremely difficult actually. And dermatologists already have a vast toolbox out there to help them in their everyday job. However, we believe that performance can always be improved, and it needs to be improved, and that this toolbox cannot be diverse enough. So that's why we'd like to incorporate AI-based tools into this toolbox. And those tools are simply programs which can distinguish benign from malignant lesions based on dermoscopic images. We started off our work by developing multi-class and binary class classifiers and testing them against dermatologists. And as you can see here in the graph, we have a binary classification task between melanoma and nevus. And all you need to know is that the performance of the classifier is the blue curve, and the red dots are the performances of the individual dermatologists. And you want to be in the far top corner. And as you can see, the classifier already outperforms some of the dermatologists and performs equal to others. But the goal was never for man to be against machine, but man to be with machine. So we strive for this synergy effect. So in a study which we're currently doing right now, we're combining the two and seeing if and how dermatologists can incorporate the diagnosis of the classifier into their own diagnosis. And as you can see here, we have the same setup and the shifts indicating the before and after. And the thick red line, which you can't really see here, indicates an overall improvement in performance, not just for sensitivity, but also for specificity, which is crucial as there's usually a trade-off between those two. And there we had an improvement in both of them. And all of this will lead to the incorporation of this tool into the clinical workflow, where in addition to its good classification skills, it also brings a lot of other advantages. So because it's a technology, it lends itself to be used as a smartphone application app. And that's great for dermatologists and all practitioners in general. Because if it's on a smartphone, it can be used for large-scale screenings and doesn't have to be used in specialized centers. So in large-scale screenings, it can really have the most effect. In addition to that, you can also use it for individual patients, which are at high risk at home, basically. And the good thing about using it for dermatologists is that they receive an instant feedback, which then they can sort of use to improve their own decision-making, hopefully. Thank you.